Good afternoon, Dr. Smith. I wanted to discuss a case with you, a patient with suspected tuberculous meningitis.
Afternoon. Of course, let's dive into it. What's the patient's history and presentation?
The patient is a 35-year-old female with a history of untreated latent terabytes. She presented with severe headaches, fever, and altered mental status. Lumbar puncture confirmed elevated white cell count and protein, suggesting meningitis.
Tuberculous meningitis is a serious concern, especially with the untreated latent terabytes history. Have you started anti-tubercular therapy?
Yes, I initiated rifampin, isoniazid, pyrazinamide, and ethambutol as a part of the initial 4-drug regimen. But given the severity, I'm considering adding steroids to reduce inflammation. What's your take?
That's a good call. Steroids, especially dexamethasone, have been shown to reduce mortality and improve outcomes in tuberculous meningitis. I'd recommend starting dexamethasone promptly.
Perfect. I'll add that to the regimen. Regarding the anti-terabytes drugs, any specific concerns or monitoring we should focus on?
Watch for potential hepatotoxicity, especially with isoniazid. Regular liver function tests are crucial. Also, the patient might need vitamin B6 supplementation with isoniazid.
Noted. I'll ensure close monitoring. What about the duration of treatment? Is it the standard 6 months for this patient?
Yes, for tuberculous meningitis, a more prolonged course of therapy is often needed. We're looking at a minimum of 9-12 months, and sometimes even longer, depending on the clinical response.
Got it. And what about prophylactic anticonvulsants? The patient hasn't had any seizures, but with the central nervous system involvement, I'm considering it.
It's a reasonable consideration. Seizures can be a complication, and starting prophylactic anticonvulsants, like phenytoin, might be prudent.
I'll include phenytoin in the plan. Lastly, I was thinking of involving the infectious disease team for ongoing management and to ensure we're on the right track. Your thoughts?
Absolutely, a great idea. Their expertise can be invaluable, especially if we encounter any challenges or need to adjust the treatment plan based on culture results.
Thanks, Dr. Smith. I'll make those adjustments and keep you posted on the patient's progress. Anything else you'd like to add?
Just keep a close eye on the neurological status and any signs of complications. Early recognition and intervention are key in managing tuberculous meningitis.
Will do. Thanks for your input, Dr. Smith. We'll work closely on this case.
My pleasure. Teamwork is crucial in these cases. Let me know if you need anything else.
Absolutely. Have a great day, Dr. Smith.